speaker will be Sajjad Rajpar, a dermatologist from Birmingham, United Kingdom. He will talk about when acne scar treatment goes wrong, severe facial and nasal keloid formation following after cosmetic intervention. Please.
Thank you. Good afternoon. Thank you for the introduction. My name is Sajjad Rajpar. I'm a consultant dermatologist and Mohs surgeon in Birmingham, England. And I'm presenting a case of complications of the treatment of acne scarring. I have no conflicts of interest other than to say that all the good clinical outcomes are not attributable to me in any way, shape, or form, because this is one of Michael's cases, which I saw when he graciously hosted me at his office and saw him at work there. And this case particularly resonated with me because the underlying activities are very much something which we carry out in our clinic, and also a problem that we're seeing in the United Kingdom. And here is the case. So this is that of a 25-year-old lady who had acne scarring. And this is her before any treatment. And she went to a Medi-Spa and saw a nurse provider who advised her to get subcision for atrophic scarring. And these are the photos she provided to show what she looked like 24 hours after subcision. Now, we do a good amount of subcision at our clinic, and just on first view, this does look quite bruised and hemorrhagic for a routine subcision case of ours. Anyway, 3 weeks later, she developed subcutaneous lumps to the point that she says that she could not cover them with even thick makeup. And this caused her understandably significant distress, especially when her primary concern was that of facial scarring. So she has developed keloid. The provider said, we can improve this with CO2 laser. Okay. Now, I should just say I did have a little look, and it's not my practice to criticize or comment on other clinics or Medi-Spas, but the Medi-Spa appears to specialize in predominantly laser hair removal, injectables like Botox and fillers, and ultrasound-based skin tightening. So most of the reviews appear to be directed in that way, not related to surgical procedures, invasive surgical procedures that require local anesthetic surgery. Anyway, so she is advised to have free CO2 treatment, not charged for this. Come back and I will show you. Anyway, sorry, before I move on to that, I forgot I've put this slide in. For those of you who don't know what subcision is, the assumption is that if you have an atrophic scar, there may be some fibrotic bands under the scar from the dermis, pulling that scar down, causing indentation, and you put local anesthetic in the skin and you separate the dermis from the fat. So it's a subdermal undermining. You could use a green needle or an orange needle. You could use a blunt cannula. You could use a subcision tool that is designed specifically for subcision, like the Taylor Liberator, or a V-shaped fat cannula some people use, or a no-core needle, which is a very, very sharp instrument which cuts on both sides. It's extremely sharp and it's quite broad. So the entry points for this are quite broad. And because it's so sharp, you don't know whether you're in the dermis or subdermal. Some people may lose their plane because of it, and you can easily cut through the skin as well. So you do need to be reasonably experienced before digging this into somebody's skin, I should say. So anyway, she developed these lumps 3 weeks later. She was invited back for free to have CO2 laser. And this is her photo that she says 2 days, a day or two later. And you can already see she has some contiguous erythema and inflammation more than anywhere else on the left side of the nose, where, if you remember, she didn't have any issue. When you look close up, this area took at least 2 weeks to heal its loft. And 3 weeks after the healing, she developed this lesion. So she developed another keloid at this site. And You can see that the keloid is different to the other keloid that was caused by subdermal injury, which I believe, was from reasonably heavy subcision, but the injury was under the skin and probably on the underside of the reticular dermis. That's where the trauma was. Whereas here we've got trauma coming in from the epidermal side. So different type of keloid. That was a subcutaneous nodule almost, but fixed to the dermis. And this is an exophytic superficial type keloid. So you can imagine her distress 3 weeks after the treatment for her keloid, and this patient wouldn't know any better. She now has another lesion. So CO2 laser, for those of you who may not know, drills holes, when we're talking about fractional CO2 laser, drills holes which ablates skin, removes skin, columns of skin. For every hole, there is heat delivered around that hole. That's called a zone of thermal damage. It's a treatment we do day in, day out at our clinic, okay? That's heat. Can you see the hole in the middle and the heat around that's cooked the skin? And we want a little bit of cooking, and that's where some of the cellular and biological effects come from. However, if you place too many shots too close together, you will cook the skin through and through. And really what's happened here is that she's had an unwanted thermal burn from perhaps overstacking the laser, doing too many passes, being distracted at the time. We don't know what exactly happened, but some misdemeanor has happened. So this is not routine fractional laser. This is a side effect of fractional laser. So she was then offered more treatment for her keloid in the same place. Again, a Medispa that specializes in hair removal and injectables. Further CO2, a second CO2 session. Somebody really has the nerve and confidence in their treatment, really. And 2 V-beam sessions and 5 steroid injections, okay? And this was her presentation to Michael's office. And you can see the keloid scars as provided in her own photographs, not changed dramatically, and a significantly distressed, very pretty young lady. She was treated with the intralesional chemotherapy protocol that was described earlier today and published. And I'll just draw your attention to the concentrations of the medications. The triamcinolone at 2 milligram per mil was an eye-opener for me, but this is very low-dose triamcinolone, low-dose fluorouracil, low-dose vincristine, and low-dose docetaxel. So she was given multiple, and this is published as well. So she was given 3 sessions, and this is her visiting at her 4th. And you can see actually when she had her makeup on, and she was wearing reasonably thick makeup, you couldn't actually tell where her scars were, which I think is a triumph in itself. When she removed her makeup, you could make out the nasal scar, and you can just see how much it's regressed by the height and the width. And in fact, it's actually, the pointer doesn't allow me to show you, but if you just follow the alar crease, that whole area almost looks normal now. The erythema has gone. And in the rest of the lesion, the erythema has substantially subsided as well. So we're starting to see almost normal nose, at least at the inferior pole. And also her subdermal nodules had improved quite a bit as well. Again, with makeup, you couldn't actually make these out, and they were actually quite difficult to feel. So they had softened and involuted quite a bit. And what I think drew me was that if we were to treat somebody like this with conventional triamcinolone and or 5-FU, it's actually really difficult to pinpoint the treatment and mitigate steroid-induced atrophy at the normal concentrations that we use. And we know there are some limitations to steroid monotherapy as well, which is what she had been given before. Now, it's important to be aware that this treatment of subcision exists. It's usually provided in medical establishments with experienced doctors, but increasingly, like other treatments, you will start seeing these in the shopping malls and the Medispas, unfortunately. And tunneling of instruments under the skin has been reported to cause keloid. There's only one publication I could find where they cited two keloids, a nodule at the site of entry on the left, and then a very much cylindrical sort of keloid where the skin was undermined and detethered, and again, trauma to the underside of the reticular dermis, I imagine. I could not find any cases of facial keloid following fractional CO2 laser. There are certainly cases of fully ablative CO2 laser where the skin is 100% vaporized deliberately to remove skin lesions, for example, or for rejuvenation, but none in the context of fractional laser. So what are the learning points? We need to be cognizant that there's increasing provision of what I would classify as reasonably invasive surgical acne scar treatments in the cosmetic sector by non-specialists and non-medical providers. Subcision is a technique used for acne scarring, and despite it being subdermal, carries a risk of keloid formation. Technique may matter, the device that you use may matter. We don't have enough cases to know. And of course, any device, any energy-based device can burn the skin if it's used inappropriately, and a burn has an inherent risk of keloid scar formation. Really, practitioners should recognize keloid disease, and she's clearly prone to keloid formation, and you would want to be even more hyper alert when doing a subsequent treatment to ensure you're following her up closely and mitigating the risks of keloid. But practitioners should recognize keloid disease and refer to specialist centers for appropriate management. And I think this case really interestingly highlights how intralesional chemotherapy is very well suited to complex facial keloids with a low risk of atrophy compared at least to high-dose steroid monotherapy or high-dose steroid with 5-FU. Thank you very much.
Thank you very much for the excellent presentation. Are there any questions?
Yeah.
Please proceed.
May I give a comment? I think that the subcision you showed, that's indeed a keloid. But
that's indeed a keloid, did you say?
Sorry?
Did you say the subcision that I showed?
That was a keloid. Yeah, but the result of the ablative CO2 was not a keloid, because if you look at the pictures, there is no grid, and the skin on the nose, the side of the nose, is a lot thinner than the skin on the cheek. So probably this is a burn, a deep burn, and I think it's not profractional used, but ablative. And so you see what you saw was a deep thermal burn and a hypertrophic scar. That's what I think.
No, that's fair enough. I should confirm it was a fractional device because I checked on the clinic's website as to what they offer.
Yeah, but when you look at the treatment, when she was treated, it was a redness everywhere.
Yeah.
Like there. And but the first picture, you don't see any grid. So it was not fractional. Otherwise,
I don't think that the absence of a grid, and sometimes you just see erythema in poor resolution photos. We take daily pictures of everybody who has a fractional laser. That sort of light level of erythema, I don't think this is ablative.
I do think.
Please.
Did anyone ask her before they did all this in that terrible clinic whether she produced keloid?
This is a fantastic question. I did. I don't think anyone in the clinic asked her, but she actually had not yet produced a keloid.
Yeah, let me ask you several things. Is this a lady you saw with Dr. Turgan in New York?
Yes.
And then she came to you for treatment?
No. It's one of Michael's cases. It's not my case.
I see. Oh,
yeah, I'm just an observer and a transmitter of information.
This was my patient, but Sarge came to New York, spent the day with me, and this patient happened to come that day, get treatment. So Sarge saw the patient, obtained a lot more history from that patient, a lot more than I had obtained. And we both thought,
where's she from? Is she Japanese or Asian?
Thai.
Thai. She's very beautiful. She was also interested in cosmetics, like me, and interested in camouflage. That's what she uses.
Yes, she used
Let me just say one thing to you that you don't know.
Yeah.
I could have very successfully treated her with superficial radiotherapy. Henry and I presented a world-leading paper on the treating of recurrent keloid on the face or the head and neck, in that neck, just with 2 or 3 fractions given every 3 or 4 months of superficial radiotherapy. She would have had the scarring or telangiectasia. She might have developed that. But nowadays, with that wonderful cosmetic cream that you can buy at Boots in England, it covers up that. And that looks dreadful, of
So
course.
would you have treated those nodules with radiotherapy?
You didn't ask that. No, you didn't ask that. You see, let me just say one more thing to Frank Neeson, because he's a very respectful surgeon. But I've taken photographs of your photographs on my iPhone. And when I enlarge it, it's quite typical keloid. He's wrong to say it's not keloid. It's a keloid. It has all the hallmarks of keloid: shininess, redness, itchiness, superficial vessels. It's definitely a keloid, Frank. Definitely.
It's quite cribriform. Look at that.
Let's discuss further.
Okay. There's one.
Okay, terminology is semantic. Doesn't matter what you call it. This is what she had. You can name it whatever you wish.
Please, yes. Please.
I don't think terminology matters that much.
We discuss this one afterwards. I think we have another question.
Dr. Sajjad and Dr. Michael, very good case. I'm actually impressed with that. And more, I'd like to have a question on the patient's treatment. She went for subcision. So as a dermatologist, I'm asking you, for the subcision, did they use some fat graft or hyaluronic acid or something? Why I'm asking is the subcision result as such is good.
Yeah.
No, she has nice smooth surface.
Maybe the light, when you see the actual atrophic scars, she took it inside lighting, whereas all the other photos. So I think she has had some improvement. I think the volume from the nodules actually elevated them inevitably. I don't think they injected anything at the same time concurrently.
So it's just a subcision.
Yeah, it's really difficult. Her English isn't great. She isn't fully aware of each step of each treatment. She's kind of participated in it almost. So you can't get detailed information, but my impression is she didn't have any filler or other product put in or fat or anything. This was a registered nurse doing it, yeah.
For subcision, we use fat grafting or we use PRF. So that has very good results. So I was just curious to know whether that was used.
Yeah. We do subcision first session without any injectable product. And there is an improvement just from the actual subcision itself, we find, yeah.
It's more comment. I'm Eric. I work in a cosmetic clinic in the UK. Oh, I'm sorry. Okay. I'm gonna. Yeah. So, yeah. So I suppose more of a comment and a question to the audience. So, in my experience, I do see a lot of patients come into our clinic after fractional laser do develop mild keloids. So I think that there's no published research on this. So maybe that's something we need to work on. And henceforth, as a monotherapy, we do not suggest fractional laser as a monotherapy for keloid, which some other cosmetic clinics in the UK unfortunately does. But just opening up to the floor, I just wondered what everyone else experiences is with PDLs. I mean, we do PDLs on our patients with keloids, obviously as a combination therapy in combination with intralesional corticosteroid and 5-FU. But maybe to yourself and to the floor, what have your experiences been with 5-FU and patients with a history of keloid scars? Thank you.
So I would say I've never seen keloid induced by fractional laser in our practice, and we have 3 fractional lasers in regular use. So that would be unusual for me. What's the second part of your question? 5-FU with pulse dye laser? We don't have a pulse dye laser, but we have vascular lasers. I think vascular laser monotherapy probably doesn't do very much. It may improve some of the erythema, but in terms of keloid volume, I would never use it as monotherapy. I'd want something else. If they're flat enough, some form of injectable.
Yeah, so I think there has been done so many fractional CO2 lasers, millions and millions worldwide, in the face, full face, and it's very safe. The neck is different.
Yeah.
I don't think keloids have been reported there, but hypertrophic scars are more.
Yes, yes, and webbing and webbed scars from over
treatment.
over treatment.
If you do too many passes, you lose the fractional effect and you get full ablative effects. And in terms of the pulse dye laser, I think there's a lot of experience in hypertrophic scars, especially the early ones, the red ones. There's even consensus among laser experts, not keloid experts. In keloids, there's very little research about the pulse dye laser, but quite some people use it. I also use it, but only in combination. I think in my very early years as a laser practitioner, I tried treating keloids with the pulse dye laser alone, and I haven't seen any improvement, and maybe I have seen some worsening.
Yeah, that would be a very fair comment.